He came with nothing too difficult in terms of it's a fairly straightforward problem, something we see all the time. His history, as he explained, being a musician, quite a well-known, famous musician, is he travels a lot. So he's spending a lot of time traveling on trains and planes and sleeping in hotel rooms. But also, he's standing on his feet. When he's performing, he could be on his feet for hours on end. And being on his feet, lifting cases and equipment, music equipment. So there's a lot of physical strain on his back. And because over years of doing this and spending long hours of doing this, this will put a load and the pressure on his back that will create the back pain. As I've explained before, that when people put a lot of load in this, I mean, obviously Mehmet's a musician, but whether you're working in a restaurant or in a shop where you're on your feet and you're on long hours standing, bending and lifting, it's no different whether you're lifting cases of alcohol or if you're lifting guitar cases. The problem is that as you put strain and pressure on the back, what's going to happen is that it's going to force the spine to compensate over time, and this can happen over months or weeks, or usually in a lot of cases years, and I'm sure in Mehmet's case it's been years. And the pressure on the back has caused the spine to move, and once the spine starts to move and compensate for this, you end up causing the nerves that come through the holes in the side here to end up being pinched and trapped there. So what we do is manipulate and move the spine back into a normal position, away from the nerves, and taking the pressure off the nerves and reducing the pressure, because irritation to nerves will cause muscle spasm, which Mehmet has a lot of. All the muscle spasm and tightness he has in his muscles is usually caused by irritation to the nerves. By correcting and improving his posture and moving the spine, we'll be able to alleviate and get rid of the pain that he's suffering, yeah, as we do with most patients. Yeah.
So it's all done now? So what is the procedure?
We're actually in the middle of Mehmet's treatment, so he's probably told you how he's improving, and he's definitely getting better. He still has some pain. And this is really important, because a lot of patients will feel better and think, oh, I'm okay, and not realizing that they need more treatment, further treatment, to actually fix the problem. Because what we do here is not just get rid of the pain, we get rid of the problem, okay? And for somebody like Mehmet, who's traveling all the time and inshallah is going to have a long career and a successful career, he's going to be doing more of the same. And as a result, we have to not just fix the problem thoroughly, but also look after it, maintain it. So he's going to come later on, once a month or however, to regularly have treatment to look after this problem and prevent this from coming back. As long as he looks after it, he'll have a very long, healthy, pain-free career, inshallah, for the rest of his life. Exactly. Good. Good. Good.